I remember like pretty much the whole accident. I remember going up the road on the back of the ATV while my friend was driving on the way to cadets. And then like going across the road, getting T-boned, and then getting thrown 40 feet after the chain went through my leg.
We were on the ferry coming home and we were sitting in the ambulance. The ambulance driver at that time was a friend of ours. And he got the call saying 2 kids were in an accident on an ATV, and first thing as mom, where's Aaron? Then about 2 minutes after, I got a call from my older son saying that Aaron was in the accident.
When he was thrown from the bike, his tibia or his shin bone came out through his skin, and he lost a big piece of that at the accident scene, and we can't put that piece of bone back in. Once it's out, it has to stay out. So he had a significant injury, a significant bone loss, and was at risk of losing his leg from the very beginning.
His leg was pretty mangled. He broke his tibia and it was bleeding from the bone.
So this is a severe injury that to do that there's an enormous force to not only break a leg but also for loss of the soft tissues of the muscle, and so essentially if you don't act fast enough that'll result in an amputation.
I was scared because, well, you know, I wanted to kind of keep my leg.
I'd say with all total, it would probably be a year, close to a year. He was in the hospital.
His first surgery was what we call cleaning up the wound. Dr. Jackman and the team at the Janeway took him emergently to the operating room to clean up his leg wound and put him in what's called an external fixator. He had significant muscle and skin loss, so Dr. Rideout and his team had to take muscle from somewhere else and put it there in order for it to be covered so that it wasn't just bone exposed to the outside. And after that, then that's when we got involved and started to regrow his leg for him.
I have had probably about 13 surgeries since the accident. That's kind of when I lost count.
How we doing? Good. How's it feel? Good. Aaron was the best patient. He was excellent. He took ownership over this immediately. He knew he was mature beyond his years. He knew what was involved. He knew what the ultimate outcome was, what the goal was. He's 14. To lose his leg is a lifetime of prostheses, and so to give him his own leg back and see him playing basketball today is a great success, I think.
Aaron has thrown out he says he wants to be a paramedic. And he's also thrown out the idea of physical therapist. And I would say that was mainly because of this accident that he wants to do those things.
It's to help other children learn to walk, or even adults. Because if they said they can't do it, then I can just show them a leg and be like, yeah, you can.